Welcome to the Good, Better, Betterness podcast. We're here to get real about what really matters, not accolades or achievement, not doing more or having it all, but stripping away the extra so that you can be more present, more grounded, more rested, and more you. We're your hosts and co-founders of WellRise, Denise
and Kayla. The Good, Better, Betterness podcast is a monthly chat with and for Black women about what self-care is and how you can make it an intentional part of every single day. We share real stories with real women who are devoted to living a life rooted in better wellness and living in harmony with the world around them. Take a seat, take a breath, and explore how deep and radical self-care can transform your life. Hey ladies, welcome back to the Good, Better, Betterness podcast. Today we're diving into the deep end, the sometimes confusing, sometimes frustrating world of healthcare. But fear not, because we have an amazing guest to guide us through the murky waters.
I'm excited. Joining us today is Dr. Persharon Dixon, a powerhouse pediatrician with over 25 years of experience leading healthcare teams. Dr. Dixon, welcome to the show.
Thank you so very much, ladies. Glad to be here.
Yay! Now, before we jump in, let's give a shout out to the phenomenal Black woman who paved the way for folks like Dr. Dixon. We're talking about Dr. Rebecca Lee Crumpler. After studying at the New England Female Medical College, she became the first Black woman physician in the United States. Her legacy includes training over 100 anesthesiologists. I hope I said that right. Anesthesiologists?
Never did.
Perfect.
Dr. Crumpler, what an inspiration. 100, and this was like in the late 1800s, right? I believe it's when she made that first milestone. But she was busy, right, with training. So what an inspiration. Dr. Dixon, now let's get down to business. We all know that navigating healthcare can feel like a maze. There's jargon, there's, tedious processes, there's financing. It's just a lot to handle when it comes to individual healthcare. Where should we even begin? Let's start with this. We know that Black women face higher rates of certain health issues, like heart disease, cardiovascular disease, diabetes, stroke, just to name a few, quite frankly, in terms of just where the disparity is present. Can you talk about some of these disparities and what we can do to advocate for ourselves?
Well, you're absolutely right. There's so many disparities that hit Black women in particular, and it really goes as back as the days of slavery. Even before then, it's Black women who have had quite a bit of stress in their lives over time, anyway, and so we tend to be heads of households these days. We've had to raise families and raise other people's families and really hold up everything. And so our stressors are different. And typically African American women have hidden those stressors. And so, those kind of things compound and cause a lot of physical responses. And so the first place we start is at this point in our lives, putting ourselves first sometime. Because if we can't save ourselves, we can't save all those other people that we tend to have to uphold, right? So, that I'm really glad to see that mental health and well-being have become such great topics now. They're no longer taboo, and that's so important for Black women. So we have to start there of knowing that we have to care for ourselves if we're going to be able to care for anyone else. So with that said, the other thing about Black women and women in particular is that we tend to be the ones who are in charge of the health care of our families. And, if we don't make the doctor's appointment, the kids don't go. And even the husband doesn't go. So we are the prime people who have to know how to navigate that system so that not only our families, but we as women, Black women, can be assured that we would get what we need out of it. But those health disparities make it where we have to really be on our toes in terms of how we ask for support when we come into the healthcare system. I know there's lots of statistics out there that really show that Black women often go into the system and we're not believed, or we don't get the same care as other folks. And we may have folks out there that don't believe that's the truth, but the statistics bear that out. And so those are other reasons why we have to be even more attentive and speak up for ourselves and know that those very disparities that you talked about, heart disease, cancer, high blood pressure, diabetes, all those things that we see as leading causes of death and causes of illness in others, we will see those in Black women at an earlier stage in life and typically more advanced or more of a problem for us than others. So, yes, we have to be on top of it.
No, that's very, very helpful. And I think a lot of what you talked about, we're going to dive a little bit deeper into in this conversation for sure. But one of the things that you mentioned was just navigating, right? Like we have to be educated and equipped to essentially navigate the terrain, because a lot of times we are the person in our household who is responsible for, like you said, our healthcare, not just for ourselves, but for the entire family. Are there any specific organizations or resources that you would recommend to Black women where they can actually find that support and kind of get help navigating the terrain or navigating, their specific needs for the organizations? And I know there's like MyChart and the different apps that the hospitals use to send appointment reminders and things of that sort. But I'm just wondering if there's any other organizations at the ground level that you've kind of seen, or resources that people can be looking into to really make it easier, right, to navigate. There's no getting around it. It's something that has to be done.
Yeah. Well, the great thing is that because of technology, you really have it at your fingertips. I mean, good old Googly out there will tell you a lot of things that you get, where to get information and how to move forward on that. But certainly, as more women are in the workspace, they have access to information regarding their employers, opportunities for them under insurance, and of course, if they're not receiving employee insurance, then you have access because of the Affordable Care Act to affordable insurance for families. It's why that piece of legislation was so very important, because it really supports the well-being of women who are in that gap. There are some of us who just make just enough money not to be able to get Medicaid, but not enough to get the employee-based, or if you are now like where we are with a lot of young folks and women like yourselves who are entrepreneurs, small business owners who may not be able to afford a big healthcare plan. The Affordable Care Act is there for you. And so, just knowing what the resources are that are available are important, because that will help you to get on a trajectory of taking care of yourself on a regular basis. So preventative health services, and those kind of things really go off the table when there's no form of payment that you can think of. So we tend to use the emergency room more as our healthcare of choice when we don't have a resource for paying for that care. So that would be one of the bigger things I think women can do for themselves, even if they find themselves in a entrepreneurial space or in a a position where they make just a little bit too much for our government supported health care, that they then look into the Affordable Care Act, but look into something. You need to have something that's available for you and for your family. And then, of course, for our children, we have a few more options. But again, good old Googlier is good for that. And looking into the different kinds of governmental options, as well as if it's a private insurer. And they all will give you numerous options for what could be best for you and your family.
I love that because, Google. How do you say it? Googlier?
Googlier. Yes.
I love it so much. Yes, Googlier. And I know sometimes that can be, very daunting, and a lot of information comes up when someone may Google. But I think, tips like making sure to put your state in there, right? Or even your local area, just to kind of drill down a little bit more, I think are things that women can do, especially if they're looking for something through the Affordable Health Care Act. I have a question about kind of that, the statistic you were mentioning before, right? This almost feeling unheard, not almost, actually feeling unheard, feeling gaslighted, and being completely dismissed by doctors. I know this has been a little bit more in the news in the recent years because of issues, or because of celebrities, right, who have come out. Beyonce has come out about this. Serena Williams has come out about, really feeling ignored despite them saying this is what I'm feeling, these are my symptoms, and feeling that, they're not being advocated for. Is there any advice that you have for Black women looking to stay not only informed, because we've been talking about that, but how to properly communicate their healthcare needs? Any kind of specific questions we need to be asking, and any other ways that are really good to navigate that piece of this, right? This piece of being ignored, being dismissed, etc.
Well, yes, use your voice. One, I guess one of the first things is believe yourself. Trust your gut. We've always had good guts. We know when something's not right. The perception of Black women not being in pain or not really being ill, I think also speaks to us being looked at as superheroes. We've always been the stoic ones that will give our last breath for everybody else. We will stay quiet. Even though we're sick, we've got to keep pushing. And so when we do speak up, it's just, hard to believe that this Black woman in front of me who looks so healthy and put together could be experiencing what she says she's experiencing. And so believing in your gut and being persistent about what you are telling them, or telling whoever you are seeing. And then again, I go back to the importance of having your own health care, your own primary care provider that you get to know and become familiar with, and they with you, where you have a relationship that helps to propel, your being listened to, being, if you ended up in an emergency room, you could call your primary care provider and they would tell you, oh, no, I need you to do something different because I know Miss So-and-so would not be there if this were not the case. It also speaks to the need, I think, for us to always consider, and I know this may be controversial, but consider adding to your health care provider list someone who looks like you. I think it helps you, when you are, what you're saying may resonate more with someone who has similar issues as you, similar thoughts as you. So I have a woman doctor because I feel like she's going to listen to me in a way that I may not have with someone else. And that doesn't mean that another physician, be it male or other ethnicity, isn't good. It means that I just feel like I may have a better connection. And so all of those kind of things have to come into consideration when you're thinking about your healthcare team and what that looks like for you. But being persistent, going back, saying, no, we're gonna have to think about this again, especially women who are in the childbearing ages, where we have too many Black women that we're losing during and after, well, I guess before, during, and after delivery. And so those statistics, though, may not be as readily noted by some other folks that you're going into an emergency room. They may not have that on top of their mind, but we need to know that, some of the signs and symptoms we have may need to be watched a little bit longer than maybe someone else, and we have to be persistent about that, saying so.
I think
that is something.
Yeah. I was going to say, I think that's so good, especially you mentioned the idea of having a healthcare team. And I think especially in a time when you are preparing for labor and delivery, you need an actual team that you've been working with and that understands what you want to happen, right, in that scenario, in that situation. But I also think it's interesting finding that, like, where do you go for that team sometimes, right? Like sometimes people only understand, like, even the idea of having a primary care doctor, I don't necessarily think is common in our community. I think a lot of times we have this symptom and we go and, either go to the emergency room, go to urgent care, or we go to, pediatrician, somebody that's specific for whatever the symptom is that we have. So like outside of the typical hospital, right? Where do you actually go to start building that team and start finding those people that actually look like you? I think that, to me, it's not a direct answer. And I know Googlier.
Right. No. Well, and the way we do medicine now, it has rapidly changed, right? And everybody is moving toward a more, what we call, patient-centered model, where we understand more and more that a care team is important to the overall health of a person. You're seeing that across the board. You're seeing that in private offices. Insurers are recommending that or having those options for their client base. And then again, I go back to the Affordable Care Act, which was really trying to push that model of getting you with a provider so that you get these preventative health things done. It becomes a routine. I regularly go to the doctor for these things. It's almost it's been hard for me as a pediatrician to understand the resistance of adults to that model, because it's what they do with their kids. We start you out as soon as that baby is born. We say, okay, I'm going to see you every 2 months until this baby is a year old. And then, okay, we'll go to once a year as long as your baby is healthy. And then I'll see you until this child is 18, 19 years old, and maybe 21. If I like them a lot, I'll keep them through college. But it's that relationship. It's hard for me, or it had been when I was practicing medicine, to let a kid go that I've been taking care of since they were 18, 19 years old. And they could walk into my office and I know exactly what I need to do for them now. So that same relationship that we have built or helped families to build in taking care of their kids is what we're saying adults should be doing as well. And so, but I bet you will find that there are many centers now that, you will, if you get into a practice, they may have an app that you go on and you can now see your own chart. It's a portal where your information is shared from that one doctor, and then if they have to send you to another doctor, well, now that doctor has access to your information, and you can see all of your stuff in one place. And so that's important to have. These doctors will have a referral base where they can get you to the specialist that you need, but the primary care doctor is the key. That's the gatekeeper. That's the person who says, okay, well, let me send you to Dr. So-and-so because, we'll be able to gather your information from there, or this is exactly who you need now. And they kind of serve as your guide through the healthcare center, or the healthcare for you or your family members. And then I love that now more and more we are seeing behavioral health become a part of that system, as not just an add-on, but as, a part of what we're supposed to do. We're supposed to take care of ourselves, not from the neck down, but the head down. And, so those questions are being asked. When you go into your primary care office now, and you're there, say, for the first time, they're going to ask all those questions of, have you ever had some times when you feel really down and sad and you can't get up and you can't move? They'll ask those questions that will lead them to think about whether there is another aspect of your care that needs attention. And so that's the first place, the primary care provider. There are all kinds of systems. We have a community healthcare system that I came from. I worked in public health for the longest. So community health centers all over the country. That was another thing that the Affordable Care Act did, was allow us to have more of those in place, and more of them that could care for folks that weren't only on government covered insurance, but also private insurance. And those centers look great, and they have everything that you need right there. The dentist is there, the psychiatrist is there, the specialists are there, the primary care doctor is there, a surgeon might be there. And so these one-stop shops are a great option for anyone. So the system there are a lot of choices, a lot of things we can do. Now, when we get out into rural health center areas, a little less of choice, but still primary care providers who can get you where you need to be.
Yeah, no, I can imagine with the priorities that adults have in today's day and age, that probably your healthcare is just one of the things that kind of falls off the priority list. And 2 months, going every 2 months seems a little aggressive, right? But yes, you do take your child to the doctors, like you said, first it's 2 days, and then it's 2 weeks, and then it's every 2 months, right, for a couple of years. So it is interesting to kind of think about that similar type of model for yourself. I think about it as like, there are people, we stand on the scale every single day, right? So there are some numbers that we're paying attention to on a daily basis. But outside of that one number, what are some of the other like numbers that when we're going to these appointments with our primary care doctors, and we're being a little bit more attentive to what's really going on the inside, and not just, the appearance of what we look like and what that equals to in a number. What are some of the other numbers that we should be paying attention to at these appointments with our primary care doctors?
Well, of course, when you first go to your doctor, the first thing they're going to do is what we call a set of vital signs. And you'll always get that. The nurse will take you back, and the doctor wants to know a few things. They want to know if you have a fever. They want to know what your blood pressure is. They want to know your weight. They want to know your height for the day. They want to know your heart rate. They want to know your respiratory rate. So all of those kind of give us a general, just a little look-see of how you're doing. It tells me a little bit about your heart, a little bit about your lungs, tells me a little bit about what your whether you might have hypertension or high blood pressure. And then sometimes we'll throw in, and not sometimes, you will have some laboratory work thrown in there. So we will generally get a urinalysis that'll tell us how your kidneys are doing. We might get some blood work that'll tell us about things like your cholesterol level, your thyroid. So general information on a regular physical exam will tell us just about something about every part of your body that we need to know about. But for Black women in particular, and for all, really for minorities, that blood pressure number is a number you need to know. You know, a 120/70 is where we like folks to be, is normal. And then above that, and then we're starting to look at what are some causes, what are some reasons why your blood pressure might be higher than it should be. I forgot to name the good old what we call AccuCheck, to check your sugar, because we always got to check our sugar. But we have a lot of information now that we gain that gives us some clues as to where your health might be going, which is why the preventative care visit is so important. Because now we can look at things and say, oh, you're in a pre-diabetic state. You don't have diabetes yet, but here are some things we can do to keep it from getting there. We're going to change your diet. We're going to, have less, have you speak to our nutritionists to help us get your weight down some, so that we can avoid medications altogether. So when you don't go to these kind of visits, then by the time we see you, again, like we said, for Black folks, we tend to go, when we get there, it's a lot higher than we want it to be, and a lot more costly to us in terms of being able to manage the problem. We're now past a diet to having to be on pills or having to get a shot on a regular basis for our diabetes, or we are now at a point where our kidneys have been affected. We call chronic kidney disease one of the silent killers. It's people don't even know that their kidneys are in bad shape until they are. And by the time you're having symptoms, we are in bad enough shape where we have to be thinking about dialysis in your future. But had we been looking at your urine on a regular basis when you had no symptoms, there are specific numbers we would have looked at that would have given us a clue that your kidneys were being affected in some way by something. That we needed to get those things under control. So certainly the quick vital signs for us, again, blood pressure, key, but there are laboratory values that the doctors will look at that will give us an overall sense of how you are doing health-wise.
Now, if you know like we know, there's nothing like a little mystery to make life a little more interesting and a whole lot more fun. Subscribe to Betterness Box today and get your very own mystery box for just $25. These custom boxes feature some of our best, most highly requested products from across the seasons, all in one box. You'll get the same promise of self-care at your doorstep with a box that provides over $100 of value for just $25. Where else can $25 get you a book, top-of-the-line self-care and beauty products, and a dose of affirmation? Nowhere. Subscribe to Betterness Box today and truly experience what it feels like to be a gift to yourself for yourself.
It is very helpful. Vitamin D, I think, is one that doctors are always telling me and my friends, like, y'all just don't get enough. Go ahead and take this. I think it's 5,000 mgCs or something. I don't know. I just be taking whatever they give me. But yeah, vitamin D is big for us too. B12, I think, is also big. And it's so empowering, right? Like when you can log into your own system and look up your chart and see, okay, last year I was at this and this year I'm at this. And, I know, there's some talk about the ranges and averages and what's high and what's not high. But I think just to know it, right? Know where you're at in general, I think is really empowering. And completely agree, because I've had some health issues in the last year or so, and being able to take that chart or that print out or log in and show them, here's what I had on this date. This is what they told me to do. This is what I did do. This is what I didn't do. Like, that's very powerful to be able to track that. And for years now, I have been very serious about this whole everybody need to be Black on my team. Yeah. Whether that's my optometrist, my dentist, like literally anybody touching my body just needs to be a Black person. And I have definitely, I didn't think about it until today's conversation about, yes, we're going to a Black doctor presumes and you'll be probably looked at a little differently just because of the nature of our histories, right? And our common histories. But it also gives you as a patient a little bit more encouragement to share, right? Like, I could imagine it's actually the other way that's probably more important. And I don't know why I didn't think of it that way. I've always thought, no, these people are experts and they're Black, so they know and they, whatever. But what about, like, I now feel empowered and more comfortable to express to them what's going on in my body and to really tell them what's going on and not be ashamed because this white man that looks like my boss at work is trying to ask me questions about my body, right? Like, I think there's something there that we have to just be honest about. But when it comes to, finding those doctors and all of those unique needs, especially for Black women, what are some tips for listeners looking for, culturally competent physicians? Because not everybody Black is right either.
That's right. Well, and again, we're back to Googlier, Dr. Googlier, right? Yeah. It will tell you if a person has a problem or not. And if you really want good information on the physicians in your community, of course, you can always check with the medical boards of that state, and they will give you that information on whether the physician is board certified or has had any kind of issues or not. But, we really, it hasn't been that long ago now. I'm older than y'all girls. But anyway, it hadn't been that long ago that we didn't always believe that a person who looked like us was the best person for us. We kind of had to realize that, the other person has to be smarter and better. But what I think a lot of us have learned over some years is that oftentimes when you see us at a top position, we've done a whole lot more sometimes to get and keep it. But I will say this about physicians who are out here, whether you went to Harvard, Howard, or Hoogla Boo, you got to pass the same medical test to become a physician. You're not going to, they don't just give them out. And so there is certain a level of competencies that have to be met and maintained in order to keep these licenses. So, my friends and I, we hoop and holler all the time about, oh, God, they want me to take another test. I got to prove my love. Every time I turn around, I got to prove my love. 10 years later, I got to have another test to tell you that I'm competent. But it's to make sure that we're keeping up and are up with the changes that occur, of course, But a good place for women to start is with your friends, with your girlfriends. Who do you go to for this and that and the other? You will find a good set of doctors just through word of mouth. And any doctor that's worth their salt, word of mouth is going to be a helpful thing for them. Of course, you'll hear different doctors on podcasts or different opportunities out here now through social media and all those things where you can come across a doc. I saw a doc the other day. I said, "Oh, if I ever get to Atlanta, I might go to his practice. He on TikTok, telling me about the beautiful smiles that he does. I looked him up, and he's good doc, got good record. But I would have never known him had it not been for that TikTok come up. So lots of ways for us as providers to engage with the public, and lots of new and improved ways for the public to find us. Now, problem number one, there's not enough of us. And so really trying to encourage young Black boys and girls to consider medicine is, one of the priorities that we have to keep in mind. I mean, we just don't have enough African American physicians coming out of schools now, and so there's a lot of push to get kids interested in sciences and in the STEM fields, so that we can get them into these into these medical schools and out in teaching. We have expanded, though, beyond just physicians to what we call mid-level providers, and that has helped to expand the opportunities to have a provider or more providers in the field. So those mid-level providers are nurse practitioners and our physician assistants. And the goal of having those providers is that they really can take care of quite a bit of the general medical concerns of people. Especially if you're a young, healthy person, you're just trying to maintain and make sure everything's good. Though seeing a mid-level provider is a good option, because they are there to help make sure that your general health is good, and they know certainly enough to be able to recognize when there is a problem. And if there's something that's a little bit out of their league, or you need more specific care, then they can get you on to an MD who may have more expertise or more information to share with you, better ways to help manage your condition. But certainly that has increased the pool. And that's another way that we are helping to make sure we have enough providers for all of those who need the care. So, knowing what all the options are is good, knowing that there are not only MDs, but mid-level providers. There are specialists who are not only physicians, but nurses and other types of other levels of care. There's even options with some of our insurers to do what we call telemedicine. And that's the only option, especially in the behavioral health care market, that you can go on to what we're doing here, get on a video conferencing and have an actual visit. So there are a number of ways to have your visits for physical care, for mental health, optometry, dermatology. All of those things can be done via video conferencing. So it's sometimes folks will say, I just can't get off from my job. I'm 8 to 5, and that's when the doctor's office is open. So when could I possibly see somebody? Well, many will have opportunity, like, hey, I have telehealth between these hours and these hours, and you'll be able to do that from the comfort of your home or from where you are taking your lunch break. So just know that, that's something for your audience to know, is that there are just so many different ways now to make your health care what it is. I mean, we can actually take your blood pressure over video conferencing. They have devices you can hook up, and they can see you can touch it with your finger, and they'll be able to see what your heart rate is and what your respiratory rate is. So technology has infinitely opened up the space for how you receive your health care.
And we do it for everything else. So why don't we, lean in on this as well? I can definitely attest to the mid-level. I went to a GI place because I had digestive issues. And I was like, who is this lady? This ain't the physician. And she was a physician assistant. And I I'm not going to lie, Dr. Dixon. I was like, I don't know where the doctor at. Right. But eventually, after we talked and I asked her every question I would ask any other doctor, she was able to answer every single question. She was able to follow up with me after through the portal. If I had any questions, she told me what to do, to take my like tests and things. And so I was like, oh, this is just like having the doctor. Like, I don't actually need the doctor right now until maybe I get a colonoscopy or whatever that is. That's the advanced thing, which I did not have to do, thank God. But I'm also like, oh, okay, you telling me that means that was okay. With the physician assistant was okay. It was.
And they're going to go back and have a conversation with the physician about the patient that they just saw. So that person is a part of your care. But, you know, unfortunately, with the limited number of providers we have, sometimes you go to make that appointment, they're telling you you can see Dr. So-and-so in, you know, February of 1940, you know, what are we in? 2020? We have an appointment in 2028. Or you can see the physician assistant tomorrow. You know?
So, and nobody want to make that physician assistant. Now you got 35 years you ain't been to the doctor.
Exactly. But knowing that, you know, that provider is in the office, you know, with the doc. Now, some of our nurse practitioners, the nurse practitioner route through as to become a nurse practitioner is different than physician assistants, and the nurse practitioners actually do their work through a nursing, I guess I'm going to say nursing education model, and their model allows them to be in practice on their own. At some point, then you'll see lots of nurse practitioners who have their own shingle, as we would say. They still have to have their records looked over by a physician, so they do have someone that they're matched up with who they can call should they have a problem. But most physician assistants are trained under the medical model, and the whole idea was for them to be an extension of the physician. So you won't see many physician assistants who have their own practices. They are in practice with a physician. But again, just a different route to some of the same kind of, you know, results, where we're trying to find many ways to expand the healthcare model so that we can do what we say we want to do. Everybody have access to healthcare regardless of their, you know, status. And we can't do that if we don't have enough people in the system to help us do the work. So it's kind of a catch-22. We want to do it, but we can't do it because we want to do it because we can't, because we want to.
Oh, Lord. You know. Chicken and egg, right?
Chicken and egg.
Now, I want to switch gears just a little bit. I think one of the things that oftentimes like gets in the way of people advocating for themselves is this thing called positional power, right? So positional power is that we typically default to believe that what somebody that holds a certain title or position is like truth. So you think about, we do this with like teachers, we do this with doctors a lot of times, we do this with police officers, and just people that hold certain positions that we've been kind of ingrained throughout our life to believe, like, the doctor says to take this medicine, gonna take this medicine, right? I mean, I think that especially for our community, is something that becomes kind of a barrier to you being able to actually feel empowered in those rooms, have those conversations, and really advocate for yourself. So I wanted to see really on both sides of the table, right? Like, what are some things that you would say for patients that, how do they acknowledge that within themselves? Like, I'm not questioning, like a question comes up, but I don't ask it because of the fact that this person is Dr. So-and-so. And then on the other side of that, as a provider, what are some things that providers can be doing when they're in those rooms with those patients to kind of start to break those barriers? Because we know that is something for Black patients that is just common, right? Like it's just something that is ingrained in us being the minorities in this country.
Yeah, I'm glad you asked it from two perspectives. So let me start on the patient side of it. You know, again, we should be training our kids, our own families, around their health equity and their health literacy. We talk about that in the community health model a lot, about health literacy, because we tend to have patients who may have less literacy coming into the community health center model. And how do you add to that piece as they're learning to even read, that they're also learning about their health and what that means? So I say on the patient end of it, healthcare starts early. It starts as early as when I'm taking care of the kids. I began to talk to the child themselves instead of the mama over here who's trying to tell me, her left toe hurts every night at 5 a.m. Mm-hmm. And so I just asked the baby, so tell me about your toe hurting. My toe don't hurt. That's what I thought. So, involving the thing, being involved in the conversation, and asking a question, whether it's, it's a big question or a little question, just ask a question of the provider, and then being clear that, I heard you, but I don't understand anything you said. And can you tell me that like I'm a fourth grader? Because sometimes we'll get into the medicalese of things. And if you are feeling rushed, to say that. I don't know if you're hearing me. I'm feeling like you need to go, or you're in a rush. Can you, do I need to make a different appointment time to be able to just sit and talk to you? How can I sit and talk to you? Because I need more clarification on this problem I'm having, or I'm just not understanding what you're saying. Mm-hmm. And sometimes you have to slow us down. We think we've said it all, and you have any questions as we're opening the door to leave out? Right. You're looking like, well, no, I don't guess so. But as a patient myself, I have done that where doctor walks out the door, and I'll call back, and when the nurse comes back, I'm like, well, you know what? I have a couple of more questions. Mm-hmm. The doctor come back. Now, I have gotten those runarounds where I say that, and then, 20 minutes later, it still haven't come back. I just stick my head on out the door. It's like, when is the doctor coming back? So sometimes we have to be persistent, again, speaking up on our own behalf. Now, on the physician side of it, yes, we can take a little more time to leave the doctor ease out the door and remember who's sitting in front of us. When we started with the electronic health record, that was where a lot of my own friends said, gosh, we're so busy having to type that we can't even see who's in front of us. You forget who you were in the room with. Well, as soon as you walk out the door, like, what was that? Because you've had to do that. So getting back to making sure that we are making eye contact, that we are actually in conversation with the person that's in front of us, and we can, because a lot of things are said in the face of a person. You can tell whether they are worried. You can tell if they understand. You can tell they're angry. Mm-hmm. If we just take a little look at each other, and we can, all of that is said in just that moment. So taking a moment to do that, sometimes we're rushed. We've got 20 patients waiting, and we're trying to figure out how to do all of this in 5 minutes. So sometimes we just have to slow it down, and we have to be able to say to the next patient, I'm sorry, it took me a little longer. I really needed to spend a little more time with my last patient. Now I'm here for you, so let's talk. But what really bothers us now is if you come in there and you've already talked to Dr. Googlia and you want to tell me what to do because Dr. Googlia already told you. We have a problem with that. Because some patient will come with all these stuff written there. I did my research, and Dr. Googlia said that could be a problem because but it's okay to say, I'm wondering about this. It's all sometimes it's all in a tone or but not in the Dr. Google said this, so I'm gonna need you to write me a prescription for such and such. No, that's not quite how that works. And we may later tell you, oh, let me see what you have there, so I can see that. Some research that folks think is good research is not good research. You know, and sometimes we know that by we can tell you, you know, well, did you see down here in the fine print where only 3 people were in the study? You know, so yeah, it had a 98% rate because 2 of them made it, 1 of them didn't, you know. But, you know, we're going to need a few more people in that study. So those kind of things the patient might not know. So it's just making sure that there's a good synergy. That's why developing the relationship is important. That's why going more than once a year. I mean, not more than once a year, but at least once a year. You're developing a rapport with that doctor over time, and seeing it that way as a relationship. But yes, we both have work we can do on either side to make that relationship what we want it to be, you know.
And Dr. Googlier, so Googlier is good when you're researching where to go and who to go see and all the things, but don't make Dr. Googlier, like Googlier didn't go to medical school.
No, he didn't go to medical school. He can tell you where I went to medical school. He can tell you I went to medical school, but he didn't go. I'm going to tell you that. He did not.
Right. Okay, our last question before we get to rapid fire round is our health is our wealth. We know that. We love to talk about that at Betterness Box, but what's one final piece of advice you have for Black women to obtain optimal health and wellness? Just one last statement that you'd like to leave us with, considering, you know, all the things that we need to do in our busy schedules and all the things.
This is for all Black women, including myself, and I don't follow it myself, so I'll start with that. Do the thing we know we're supposed to do. We're supposed to eat right. We're supposed to exercise. We're supposed to take a little time for ourselves. Eat right, exercise, take a little time for yourselves. Now, we all could follow that. We'd be in better shape than most. And so easily said, not always easily done. But, you know, I say it every day. I'm going to make it priority. I've said every day, I think, for the last couple of weeks that I'm going to do some yoga. And that mat is still sitting over there. So we know what?
Look at it.
Rolled up into mat going, yep, I'm going to get right.
A couple minutes of yoga in right after this session. All yoga is.
There's the yogi.
Just go certified yoga. Well, you know, for 5 minutes. And you
give yourself some grace, you know, give yourself some grace. So this week I said, I told my husband, no more Cokes at the house. I'm going to drink a Coke on the weekend. And I'm sitting here with my water and I'm excited because it's good. I've got my water, you know. So give yourself some grace, and sometimes you're going to fall back and you just pick up and start again. But, you know, we got 3 things that we need to do. And if we do those, we'll be in good shape.
And I think one of the pieces of kind of what you just said is the intention, right? I think we don't give enough like reward to the fact that like we have good intentions, and it starts with the intention, right? Because without the intention, you're really not going to do it, right? With the intention, a little bit of grace and a little bit of consistency, support, and things of that sort, you will, in the right motivation, you will actually get to the point where you get on that mat, or you drink the water, or you eat, you know, 1 meal that's vegetable based a day, whatever your thing is. But it really does start with like have that intention and set a specific intention for yourself that's going to put you on the trajectory of a habit that's going to be a little bit better for you.
Absolutely.
Down the line.
Speaking of intentions, Betterness Box is basically that, right? Like we literally created the thing we knew that we needed. We look at it as almost a domino, right? And so it's that first domino in the line. Once you subscribe to Betterness Box, it just becomes one of those like, oh, reminders, right? Every 3 months, check in with yourself. Am I taking care of myself? Am I eating right? Am I taking some time for myself, right? Exercising. And so that's literally why we created this product, because we knew on a consistent basis, we need those reminders. We need that encouragement to kind of give ourselves that grace as well. So definitely set me up for that one, Denise. I couldn't help myself. I had to.
No, that absolutely. And we do need those reminders. And you know, that because if we don't have them, then 5 months goes by and 7 months goes by and you forgot. I don't know where we are in the process now.
We are at the rapid fire round, so I think we have about 5 minutes left total.
Okay. Well, I did want to leave out, you asked about ways that Black women can make sure that they stay, you know, healthy, or they can find ways to make sure they're doing what they need to do. I'm a big advocate of the buddy system. Find a buddy. I have a buddy that we make sure we get our mammograms every October. We bug each other to death until we know that it's happened. But you can find a buddy for all kinds of things, for that, to remind you of your preventative health visit, to walk with, to, you know, have tea time with, just to relieve stress together. But a buddy is a great option for, you know, for us especially. We need a friend to help us.
I think that's a very tangible. We like to give tangible things that we can do. But easily you'll get a text message like, "Hey, let's go get pedicures," right?
Yes.
Go get our nails done. Brunch, right?
Oh,
like,
right.
It's like, let's expand the activity set a little bit to include those healthcare and those kind of components as well. And like when you were saying earlier of asking a friend for who they use, right? Like, I have been going to my dentist for, I don't know, 15 years. I've referred her to several. She's a woman of color. She's not Black, but she's a woman of color. Gynecologist, like in Chicago, we've been doing this of like, who do you go to? Because I trust your opinion, right? If I trust your opinion about certain things, then there's certain other things that I probably would at least use as a starting point to trust your opinion. And it helps to just break down the consideration set. Exactly what you're doing, right? Like, I might ask Kayla where she got her nails done today, but that doesn't mean I'm gonna go to her place. Like, I'm up their reviews, but it at least gave me, you know, one option, so I'm closer to making my decision.
Right.
No, that's excellent. Community is where it's at. We know that.
We're deep. We have a deep community, so why not use it?
Absolutely.
Why not use it? Yeah, bring this into the conversation as well. Okay. Rapid fire round. I just wanted to do that. You ready, Dr. Dixon?
Sure.
All right. Favorite healthy breakfast?
Ooh, avocado toast. Oh, my daughter turned me on to that. Yeah.
You got to make it at the house though, because it's expensive in the.
Oh, absolutely. I know we're taking it home. I'm like, Dunkin' Donut avocado toast, $6.
Maybe 2 or 3 little, you know, accomplishments. What is it? What's the word I'm looking for? Compliments.
Yep.
You just got to make it in the house. Get you some of that. That everything bagel.
Everything bagel. I was
that's from Trader Joe's.
Hold on.
Yes. Get you some of that. A little paprika. A little
Right.
Fried onion. Bread and some tomato. Yes.
And it's something I can make. Yeah.
Yep.
All right. The next one is, what is your go-to stress reliever?
Go-to stress reliever. Dancing. I have 2, dancing and laughing.
I love it.
I love to throw on a good comedy. It's a good comedian. Oh, I'm all, yeah.
Okay, now I have to ask the backup that's not on the list. What's your most favorite stand-up?
My favorite stand-up?
Either comedian
or Al Sadiq is my favorite right now. His name is Al Sadiq. He's really talented. I like newbies. I like to see them when they're fresh and just getting going. And and they're out there, the ones that are, they're not silly. They're funny. They're not silly. And so, yeah, I like Al Sadiq.
All right. We got to look.
I know. I'm about to look him up ASAP. I love comedy specials. One book you would recommend all Black women read about health?
About health?
Yeah, health or wellness or...
Oh, I haven't read any of those. Let me see.
Right. She's like, you want these textbooks or not?
Yeah, right. Yeah, I'll be reading for pleasure. Let me see. I'm trying to think. A book for health.
We did talk to Dr. Rita Walker about mental health yesterday.
Yeah.
And she has a book called The Unapologetic Guide to Black Mental Health.
Mm-hmm.
And so we were like, that's a great example, right? Something like that. But yeah, it could be any book you recommend.
Well, I mean, the ones I read for health are just things that make me feel good. I love good poetry. Nikki Giovanni is one of my favorites. And I love every time I catch a good Maya Angelou doing her interpretation of her poetry. So when you say for health, that to me is good health, or just a good read that gets me away from the tragedies in the world, because I get caught up. Looking at YouTube after YouTube after YouTube of craziness.
Mm-hmm.
And so something that takes me away from all of that is what I call good health.
That is real for sure. That is real, especially because social media is like all in your face, right?
Yeah,
and
you need to I love some poetry.
I love that. Yes.
All right. And the last rapid fire is last words of wisdom. Just based off of the conversation that we had today, what are some last words of wisdom?
Well, again, remembering who we are as Black women, the really I don't want to say the head of our families, but the mothers of our families. We're the ones that kind of keep the family together, and without us, the family falls. So we have to keep ourselves healthy so that we can maintain or help to maintain the health of those around us, in not only our immediate families but our community. We are we take on all of that, and so just keep being who we are, and when we do that, when we take care of ourselves, we help our communities to thrive as well, because we tend to share that information with our neighbor, and so we're important. We're kind of the spoke in the wheel, and so we got to keep that thing oiled and moving.
I love it. Amazing. Dr. Dixon, thank you so much for joining us today. You've been amazing. Sis said, wait, I don't need to prepare. I got it.
Well, you're a good group of ladies to talk with, and I love, I love the work that you guys do and what you bring to the table. But conversations like this are also important to helping us all find ways to take care of ourselves, and so I'm glad you're having it. When I read that, I said, podcast? What? I tell you, they just keep thinking of great stuff to add to their repertoire of things that they do so well. So thank you for the opportunity to share.
No, thank you so much for joining us. It's been extremely informative. I know that Kayla always laughs because I tend to go back and listen as a customer as well. Like, I'm holding the conversation, but it's a little bit different when you actually, replay and listen to the information itself, which is what we are doing. We are of the community that we are, having these conversations for. So I will be listening to this episode again and taking notes and doing all the things to make sure that as the pillar for my family and my household, I am properly informed and out there advocating for us as well.
Well, last word, I forgot about the one big thing that a lot of Black women are finding themselves doing. That's being caretakers, not only of your small kids, but now mom and dad. And so just remember, there are a whole lot of stresses around us, but there are a whole lot of ways for us to let go of the stress, and we have to do that. We have to breathe and blow some bubbles and have a laugh or two.
Yeah, I think they call that the sandwich generation. When I was at my previous job, two jobs ago, actually, it was in the caregiving space, and there's a lot of our generation is having kids older, which means that the grandparents are now becoming kind of more into that phase where they need a little bit additional assistance as well. And so it is creating that, like I said, they call it the sandwich generation of caregiving on both sides of the table, essentially.
But you just said something when you said 2 jobs ago. It reminded me that the women of your generation, and the generations down from mine anyway, you guys ain't scared to let go of a job. Now, we will hold up something till Lord knows. I mean, so you guys are, pretty good about letting go of stressor. So
I think that's the thing, right? We didn't see our parents do it. We do it a little bit. This next generation, they're like out the door before they started the job. You know what I mean? So but that's the kind of snowball effect of us starting to take care of ourselves. And then the next generation, when they see that in the household, that's just going to have an even greater kind of impact down the line.
And as my daughter said, I prioritize my peace. I had never even heard of that until this generation.
You're like, who does that?
Come on, daughter.
We need it. Yeah. So that'll be my last word. Prioritize your peace.
Absolutely. Peace. Oh, I love that. Come on, daughter. I'm so here for it. Yeah, we say we're our ancestors' wildest dreams, right? But we're somebody's ancestors too. And so we have to do the things that are necessary so that those who are coming after us, right, have someone to say, oh no, I'm living even their dreams that were, their wildest dreams. So thank you. And to all the Black queens out there, remember, knowledge is power. Take charge of your health and become your biggest advocate.
Yes. Until next time, thank you for joining us on the Good, Better, Betterness podcast.
Bye, everybody. Thank you, Dr. Dixon, again. We love you. Hey, sis. We thank you for honoring yourself by taking the time to listen to the Good, Better, Betterness podcast. Thank you for joining us on the journey to betterness.